We're delighted to welcome Dr. César Núñez, the director of the UNAIDS office here in New York, who's here to speak to you ahead of World AIDS Day. Doctor, please.
Thank you, Stefan. Good afternoon, everyone. It is a pleasure to be back here with you ahead of World AIDS Day. I thank you all for being here. And for those of you who have not picked up material, we have at the table in the back a press release, and it has a link to the full report that was launched today. This morning, UNAIDS Executive Director, USG Bianima, launched up a powerful new report from Dar es Salaam in Tanzania. It is called Dangerous Inequalities, and here is a copy that I have with me at the time. In it, we call the world's attention to a painful reality. Currently, we are not on track to end AIDS by 2030, and the reason is inequalities. But there is good news. By equalizing, we can end AIDS. Today's report highlights how inequalities aren't merely harmful to individuals. They are impeding progress against AIDS, reducing the returns on HIV investments and putting millions of people in danger. So the report is a call for action. And I begin with the first call. We must equalize for women and girls to reduce their HIV risks. Gender inequalities are a key driver of the AIDS epidemic, and I'd like to underscore that particular one. It's a key driver of the AIDS epidemic. Unequal power dynamics between men and women and harmful gender norms increase the HIV vulnerability of women and girls in all their diversity, deprive them of voice and the ability to make decisions regarding their lives, reduce their ability to access services that meet their needs, and increase their risk of violence or other harms and hamper their ability to mitigate the impact of AIDS. Couple of examples. Adolescent girls and young women in sub-Saharan Africa are 3 times more likely to acquire HIV than their male counterparts. A recent study also found that women experiencing intimate partner violence in the past year were more than 3 times more likely to have recently acquired HIV. New HIV infections among adolescent girls and young women are declining slower than among males of the same age in sub-Saharan Africa. So addressing the HIV-related needs of both women and men is an urgent priority. Here's the second call. We must equalize for marginalized people. Discrimination against and stigmatization and criminalization of key populations are costing lives and preventing the world from achieving the agreed AIDS targets. This is true in both concentrated and generalized epidemics. For example, while HIV incidence has declined since 2010 by 58% amongst adults aged 15 to 49 in Western and Central Africa and 62% in Eastern and Southern Africa, a systematic review of data found that there was no conclusive decline among gay men and other men who have sex with men in those regions over the same period. Key populations account for less than 5% of the global population, but they and their sexual partners comprise 70%, 70, of new HIV infections in 2021. So neglect of the HIV-related needs of key populations not only contributes to needless suffering and death among those groups, but it also exposes their sexual partners to considerable risks. Here's the third call. We must equalize for children living with HIV. The world continues to fail children in the AIDS response. In 2021, 800,000 children living with HIV were still not on life-saving treatment. We know what needs to be done to eliminate the vertical transmission of HIV and meet the treatment needs of children, but a failure of leadership has prevented us from doing so, and the widening disparity in treatment coverage between children and adults is increasing rather than declining. Many children are also being diagnosed late, with 60% of children aged 5 to 14 years living with HIV not currently receiving treatment. So closing the treatment gap for children will save lives. In working to improve treatment outcomes for children living with HIV, we would also continue and even accelerate recent increases in rates of viral suppression. My last call, or the last call of the report, is to end AIDS, we must tackle the inequalities in resourcing. Our ability to tackle the inequalities that slow progress is diminished by a dire shortage of funding for the AIDS response. While the report shows that mobilizing the resources we need to close HIV-related inequality gaps demands that we confront multiple challenges, these challenges do have solutions. We are excited for the launch of this report to remind the world that World AIDS Day remains as relevant today as it has always been, reminding people and governments that HIV has not gone away. In the midst of a crisis of debt, austerity, and inequality hitting developing countries, cuts in aid for global health are not strategic. Now it's not the time to step away. It is the time to step up. It is through international solidarity that we reduced inequalities and financing and made amazing gains against AIDS, including bringing more than 28 million people onto life-saving treatment. And we must complete the job. On World AIDS Day, UNAIDS joins with people living with HIV and communities around the world with one shared call to action: equalize. Equalize access to rights, equalize access to services, equalize access to resources, equalize access to the best science and medicine. This is how we will end AIDS. Thank you so much.
Thank you so much, Doctor. Edie?
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. You've said that 28 million people need to be brought into treatment. How much would that cost? And what is UNAIDS asking for financially for this, and to, for instance, deal with the fact that women and girls in sub-Saharan Africa are unduly the unfortunate recipients of HIV compared to men, and of the fact that 60% of children everywhere are not in treatment?
Yeah, thank you for that. Perhaps I should start with the numbers. At the moment, there are about 38 million people living with HIV worldwide. Out of those, 28 million are already receiving treatment. So we have about 10 million who are not, and they have the right to receive treatment. So in our analysis for resource needs, we were estimating that by 2020, the needs of investment in HIV should be around $25 billion annually. That has come short. And for 2025, which is the next target date that was defined in the political declaration of 2021 and adopted by the General Assembly, we are looking after $29 billion a year. We have noticed how the resources from donors have shifted in the recent times. Obviously, because humanitarian needs have increased, and you cover those on an everyday basis here, we feel that this is not the time to reduce the funding. It's important to increase it. Regarding the girls in Africa, one important point that I think it's important to make is enabling girls to stay in school. Enabling girls to stay in school until they complete secondary education reduces their vulnerability to HIV infection by 50%. That is one single action. And when that education includes comprehensive sexuality education, the gains are even more significant. So in that regard, UNAIDS wants to emphasize a call, as I was saying earlier, that equalize is the way to go, reducing the inequalities wherever they are. And we call on gender inequalities, on the diversity, and also on children.
One quick follow-up.
Yes.
So there should be $25 billion annually.
Yes, ma'am.
Since 2020. How much is UNAIDS getting of that amount?
These are not resources that UNAIDS gets, but it's what the world spends
Okay.
For the response. And to give you an idea, during the last September, you may have seen that the Global Fund on AIDS, Tuberculosis, and Malaria was having a replenishment exercise here in the United States. And they were aiming for $18 billion. This would be in addition to what the U.S.-funded program PEPFAR spends. They were able to raise about $14 billion so far. They were short on their target, but it is the highest replenishment that they have had. We believe that there may be gains, Edie, when nations also bring resources of their own. And we have seen how the resources that come from the Global Fund have encouraged nations to also contribute. And we label that global solidarity, but with shared responsibility.
So what countries and what regions are not coming up with sufficient funds to tackle AIDS?
I believe that there is still a large portion, as I was making reference to, in sub-Saharan African, where the epidemic is still showing signs of not letting go. Even though we have seen a reduction in deaths because of the access to treatment, what we need to scale up is the accessibility to, in this case, education, resources, and what our report calls for is equalize. Let's get rid of inequalities. I know that's not that sounds easier said than done, but it's something that I would ask you to amplify in your notes out of this report.
Thank you. Ibtisam Azam?
Hi, thank you. My name is Ibtisam Azam from Al Arabi Al Jadid newspaper. So just to clarify first, so the science of not letting go in these areas has to do is it mainly because of finances or several different issues, including information, etc.? And then my question is about the Arab countries and the Arab world. Are you seeing similar tendencies to the one you talked about at the beginning of your report, that not meeting the goal of having a world free of AIDS by 2030? Do you have there more statistics? Could you elaborate on that? Thank you.
We do have statistics for the Arab region, and I'm sure that if not in the current report, in the one that we published in the summer, it's called In Danger. And there has been an increase in the number of new infections in the Arab world. This has been conveyed by our regional team to the different leaders there. And evidently the programs, I don't think it's a resources issue, but more like implementation of programs that are targeting the right groups. Education for girls until secondary school for us is key. Again, I may need to check on the actual statistic, but the increase of new infections, I can confirm for sure. Yes.
And do you think that has to do with that you are getting now more reports, or because it's a lot of time it's a taboo theme and a lot of people...
You make a very good point. You cannot find something if you don't look for it. So I believe that reporting, it's one way of looking at it. It could be better. We have been asking some nations to allow us to do some more research to determine with more clarity on what the variables are that could allow us to improve on the availability of services for people with HIV or for the populations. It is not it's not a secret that sexual diversity is a challenge, not only in the Arab world but in other countries, and still in many countries of the world you see a criminalization of these behaviors. So that is also part of the Equalize for the for people in disadvantage. Great.
Thank you. Any other questions? Great. Doctor, thank you so much.
Thank you, Stefan.